Once again, our esteemed viewers, you're most welcome onto the Kloud Health Media, where we normally talk about health. We talk about related health issues, whereby we need to understand how to deal with several illnesses, how we can live better lives amidst all the challenges we meet that can bring us several diseases in our lives. As you are well aware, in the month of November, we normally talk about diabetes. Have you ever taken time to understand what diabetes is? How can one get rid of diabetes? In fact, how do we contract diabetes? Today, we are hosting Dr. Asaph Byamugisha. He'll be taking us through the risk factors of contracting diabetes. Without taking much of your time, let's welcome Dr. Byamugisha so that he can take us through the risk factors of contracting diabetes. You're most welcome.
Thank you, Mr. Mika. Pleasure is mine once again for hosting me on Kloud Health Media platform. My name is Dr. Asaph Byamugisha. I'm a medical doctor. I work with the Doctor's Case Medicals Limited.
Yeah, once again, I welcome you onto the Kloud Media platform, whereby you're going to take us through the risk factors of contracting diabetes. We have always heard of diabetes. What are the risk factors that a person like Kamsime is likely to contract diabetes?
Thank you very much. November is what I would say a month of diabetes. Every 14th of November, the world commemorates what we call the World Diabetic Day.
Yeah.
And it's very important that we commemorate this day because we raise awareness about diabetes. Worldwide, about 460 million people are diabetic patients. Okay. And the tricky thing is that we have an escalating pandemic of diabetes. Every day, numbers are increasing of patients who are diagnosed with the disease that we call diabetes. Diabetes mellitus is a disease condition that can affect any person. Okay. The young ones, old people, males and females, any person can be a patient of diabetes. And diabetes has two types. There is what we call diabetes mellitus type 1 and diabetes mellitus type 2. Type 2 usually affects people who are 35 years and above, and the type 1 diabetes is usually in patients who are younger.
So but, this type 2 goes with age?
Yes, but some patients can be young and they have type 2 diabetes, or people are old and sometimes you find them having type 1 diabetes. So diabetes mellitus is a chronic illness that comes as a result of two factors.
Two?
Yes. One of the reasons is low insulin in your blood, and another reason is insulin resistance. Let me explain what that means. Whenever you eat foods that are rich in carbohydrates, sweet potatoes, posho, rice, or bread, you get a nutrient that we call glucose. The function of glucose is to enable the body to do its functions. For example, for kidneys to function well, you need glucose. Yeah. For your muscles to help you perform your activities of your daily living, maybe you're a farmer, you want to dig, or you are walking, the muscles use glucose as fuel,
yes,
to perform some of the tasks. So whenever we eat foods, most foods we get what we call glucose from the foods. After the body breaking down what you have eaten, you end up getting glucose in your blood. So that glucose is supposed to be moved from blood into tissues, into body parts that need glucose. These body parts that I was talking about, like the muscles, your kidneys, your brain. So that glucose in blood that you have gotten from food is supposed to be moved from blood and pushed into these other organs.
Yes.
And for it to be moved, to be taken into those body parts, it needs the hormone that we call insulin. So that is insulin. The function of insulin is to push glucose from blood into body organs that need to use glucose. So some patients produce little or no insulin, such that when you eat food and your body breaks it down and you get glucose in blood, that insulin is weak, that insulin is low, that insulin is not there to push glucose from blood to muscles, to the liver, to kidneys. So that now means that you get a lot of glucose in your blood, or glucose stays in blood, and we say you have high blood sugar.
So it is not utilized the way it should have been in a normal body.
Then another scenario, some patients, they get what we call insulin resistance. You have that hormone, insulin, that is supposed to move glucose from blood to muscles, to liver, to wherever glucose is supposed to be. But now your body develops resistance. It does not respect the instructions of that insulin, the hormone. So that now means that glucose is going to stay in blood, and you also end up having high blood sugar. Yes. So that is how diabetes mellitus develops. And now I want to tell everyone about the risk factors.
Yes.
So risk factors of developing diabetes can be categorized into two. There is one category of risk factors that we call non-modifiable. You as an individual, you might not do much to change those risk factors. Then there is another category of risk factors that we call modifiable risk factors. Those ones are in our control. We can do something about them. We can modify them. We can modify these risk factors to prevent diabetes developing in our bodies. Okay. So the non-modifiable risk factors majorly are two. One is genetics, the way our body is made, the genes or the nature of our body. Genetically, they produce low insulin, or genetically their pancreas does not function to produce insulin that instructs the body in a way it uses glucose. So people are born with the genetic predisposition of getting diabetes. These people usually have relatives, blood relatives, who are diabetic. You find your father is diabetic, your mother is diabetic, you have siblings that are diabetic. So you are now at a more risk of getting diabetes than someone who doesn't have any of his relatives diabetic. So that is one of the non-modifiable risk factors. The second non-modifiable risk factor is age. Research, of course, shows that people as they age, they are more at risk of getting diabetes than young people. But as I told you, there is a specific type of diabetes that affects the young ones. So still now that becomes a risk factor, age.
And we have nothing that we can do about it.
Exactly. So those are the non-modifiable risk factors. Then importantly, we have the modifiable risk factors. These risk factors are in our control. We can do something about it, and we control the cause of us developing diabetes.
Okay.
One of the major reasons why we have an escalating pandemic of people getting diabetic is because of obesity. Subsequently, we now have people who have a lot of weight, who are overweight, people who are obese. People who are obese, they have what we call insulin resistance. The fats make insulin work improperly. So fat comes into play and brings what we call insulin resistance. So patients who are obese, patients who are overweight, who have a lot of weight, they are at risk of getting diabetes. The second risk factor is what I call inactivity. People who are not active, people who are not doing exercises, people who don't use what they eat. When you eat food and you get all the nutrients, you get glucose. When you don't use it, the body stores that glucose as fat. So resultantly, you become fat. You become you gain weight when you are not active, when you are not doing exercises. So people who eat and they are not active, they are not doing exercises, they end up becoming overweight and resultantly at risk of getting diabetes. The third risk factor is alcohol. We know this is common. very many people use alcohol. Very many people drink alcohol. So people who drink alcohol, people who overdrink, they are at risk of killing their pancreas. And the hormone that I was talking about called insulin is produced by the pancreas. So people who drink a lot of alcohol, alcohol can burn the cells in the pancreas that produce insulin. Yeah. So you find that you have low insulin or you don't have insulin. So when you eat food and you get glucose in blood, there is no insulin to direct glucose from blood into other organs where it's supposed to be. So you can see now how alcohol is dangerous. So my simple advice is avoid alcohol if you don't want to get diabetic in years to come.
Diseased from alcohol.
Yes. Another risk factor, some other drugs. We have drugs that of course we use medically to treat different conditions. The commonest drugs that predispose patients to getting diabetes are steroids. We use steroids to manage some disease conditions like allergy or other inflammatory conditions. We use steroids. But a common mistake that I see people do is self-medication. People go to drug shops, people go to pharmacies, and they keep buying some of these drugs that are supposed to be for a short duration. So they keep taking these steroids, and at the end of it all, they find they have diabetes. So steroids can predispose you to developing diabetes. Another risk factor, of course, is having other chronic illnesses like hypertension. It is a common finding that patients who are having high blood pressure or patients who have what we call dyslipidemia or their lipid levels are higher, they are also now at risk of getting diabetes. So briefly, those are some of the modifiable risk factors, those factors that we can do something about, that we can control to make sure that we are not predisposed to getting diabetes. Thank you.
Yes, thank you very much, Dr. Asaph Byamugisha, for taking us through that topic, whereby we are looking at the risk factors of developing diabetes. You've heard, at least, there's something that we can take care of, that we can do without, so that we keep our lives healthy and free from